Twice a week, Jusna Begum delivers food to her neighbours in Tower Hamlets. This area of London is home to Britain's biggest Bangladeshi community, a community hit hardest by coronavirus.
Majority of the people will tell you that they know, they've heard or know someone that's passed away through COVID-19. In this street, I can tell you at the top of my head that I personally can tell you 5 people have passed away during that lockdown, and the after effect of seeing their bodies being put in a body bag and taken, I mean, it was getting common.
A report by Public Health England into the disproportionate impact of COVID-19 on Black, Asian and minority ethnic groups has identified the Bangladeshi community as being most at risk. We now know that the risk to this group is twice that to white British people. And for those of working age, the increased risk of dying from the disease is 80% higher than for their white counterparts. Jusna's role in the community includes helping bereaved families. She performs the Islamic ritual of washing the bodies of the dead before burial. But with COVID-19, the usual rites could not be followed. As the virus took hold, she received more and more calls from frightened families desperate for help.
Before COVID-19, when someone was reaching end of life, they would do their Islamic rituals to take all the remove all their jewelries off. But with COVID-19, the difficult part was advising the families to remove their jewelries before they go to the hospital. And this itself was traumatic for myself, as well as the families, and as well as the person that was going in hospital. The reason being is the family, it hit them, is that, am I saying goodbye to my mum forever? And also, how will I approach my mum or my dad that I have to remove their gold jewellery that they've had for so many years?
I met Hassan and his family in a park in Mile End. His experience is just one of the many that we've been told about.
Unfortunately, the pandemic has hit us badly. Sadly, we've lost our grand-in-law in this peak time. She was well at the beginning of the pandemic, but at some point she fallen really ill, which she was very weak.
Hassan's gran was admitted into a COVID ward where she was isolated and not able to see her family.
My gran was crying at the time. Don't leave me alone in here, because obviously I'm going to be alone. She never spent in her life alone anywhere. On Friday, we've been again told that, yes, she can walk, manage her daily needs. So we thought, oh yeah, she will be back. And we did ask when she will be back. We had real hope. And suddenly, unfortunately, on Saturday morning, we've been rang and told that my sister-in-law that she's passed away.
Hassan's experience echoes that of so many families devastated by coronavirus.
The older community still now in a shock. All they're thinking is, if we get as Bangladeshi the virus, we are dead. They lost the trust from the professionals, from the government, that whether they are taking in account, they are looking after them. They lost the trust, basically.
The Bangladeshi population have been hardest hit by this pandemic. They've faced many struggles through the decades, from horrific racism to social and health inequalities. But now, they're facing their biggest battle, coronavirus, and they're calling for support and action from the government. Originally from Tower Hamlets, Jahangir Alom is a junior doctor and a member of the British Medical Association. As a medic from the community, people are turning to him for guidance.
I'll tell you, every day I get a phone call from a different person. Every day I get a phone call from someone worried about how COVID is going to affect their lives, not just their health, but their lives. I've got uncles who are Uber drivers who say to me, Jahangir, COVID-19, I'm at high risk of, being dead from COVID-19. And what do I do? Do I go to work? Do I not go to work? What I need to know now is I need to know what my government is going to do to protect not just me as a healthcare worker, but the population, the wider population.
There is a sense that this pandemic has exposed long-standing inequalities experienced by the families living here. Halima Begum has lived in Tower Hamlets all her life. She advocates for British Bangladeshis.
Bangladeshis disproportionately live in council houses in Tower Hamlets, in very crowded council houses. They are more likely to have illnesses, chronic illnesses that are leading them to lead lives that are potentially not very healthy. On top of that, when they do actually suffer from a health situation and they need to show up at the GP, they're not listened to. They don't particularly feel confident to talk to a GP or the wider health services about what they need in order to protect themselves. So that ability for Bangladeshis to actually have a voice, it's quite limited. So I'm asking the question, when COVID hit, who was at the table making decisions about how to protect BAME staff? And if you're not in the table, at the top table as a Bangladeshi, I suspect that our response to dealing with this pandemic is going to be lagged and not real time, right?
The people here have told us that they have seen little action or support since they are identified as being most at risk. They now wait for the official response that will address their vulnerability to this disease.